129 Sarah 31.
So good afternoon, everybody. Again, I'm Dr. James Jarvis, the Director of Clinical Education at Northern Light Eastern Maine Medical Center and the Senior Physician Executive for Northern Light Health's response to the COVID pandemic. Thank you for joining us today. We certainly appreciate the media getting out some critical messaging for us. It's been a while since we've been doing these regular press briefings, but we will continue to do those now as we are seeing at least a second wave and a surge across the state of Maine. I just want to start off by saying that Northern Light Health has been anticipating that we would see an increase in the number of COVID cases across our state in this fall, and we've been preparing for the last few months in preparation for that in order to remain open, to keep our staff safe, our patients safe, our families safe, and to serve the needs of our community. We continue to remain open for all needs of health care, whether those are related to COVID-19 or not. And we continue to ensure that we have safeguards in place, as I just said. You may see that some of our practices and protocols are changed at some of our locations. We encourage people to call ahead prior to coming to one of our facilities in order to find out what's going on at each one. And we will continue to update as we have more information on that. We continue to expand out our telehealth opportunities, so many people for our outpatient practices will be experiencing a telehealth visit rather than an inpatient visit, but our doors remain open and we remain committed to you. I want to start with some numbers. Currently, we have 41 total patients inpatient across our system. Of those, 27 patients have a positive COVID test at Eastern Maine Medical Center, 1 at Maine Coast Hospital, 4 at Mercy Hospital, and 1 at Sebasticook Valley Hospital. In addition, our home care and hospice service is caring for 8 patients who are positive for COVID-19 in their homes. COVID has spread across many of our communities here in the state, and it is concerning to us that that spread continues to rise. We don't know what the future holds for us, but we are concerned that if these numbers continue to rise, we will see increasing number of hospitalizations and needs. And so it's incredibly important that we ask the community to help us to slow the spread. So please, when you're out and about in the community, please don't go out if you're not feeling well. Please try to make it only essential travel that you're doing. If you are out, please wear a face covering, remain 6 feet apart from other individuals, and just respect the fact that our businesses really need you to do this, and we need you to do this. Our healthcare workers are out in the community as well. They need to go shopping just like everyone else, and so please protect them so that they're here and ready for you if you should need us. As the holidays approach, particularly Thanksgiving tomorrow, we are asking that people try to keep their gatherings small. This is not the time to have those large family gatherings. If you feel that there is still that need, remember there are certain individuals that you need to make sure are safe. Those individuals who have high-risk conditions, like those that are over the age of 65, those that are overweight or obese, those with chronic health conditions like heart disease, lung disease, cancer, diabetes. Make sure that they're safe. Maybe this is the time that they stay home and you just do a Zoom visit. If you are going to have a large gathering, please practice the same things that we're asking for you to do out in the community. Stay 6 feet apart, wear your mask, stay socially distanced, and stay home if you're not feeling well. If you haven't gotten a flu shot yet this year, we really encourage you to do so. It is definitely not too late to get a flu shot. We want this to be an incredibly mild flu season because the symptoms of influenza are very similar to the symptoms of COVID-19. We would have to treat every patient that came in with those symptoms similarly and use those same protective measures whether we knew they had COVID or not. And so it helps us if less people have influenza. Plus, that'll help limit the volume in our hospitals, and that's really critically important for us. Testing is available for people who need testing, and so I want to encourage those of you that have either experienced symptoms of COVID-19 or feel that they have been exposed to COVID-19 to explore avenues for tests. The best way for you to facilitate getting a test in most of our regions is to go to northernlighthealth.org/testing. That will walk you through a self-process for you to find the appropriate test and the nearest testing location to yourself. Again, we are available for you at any of our needs. Please check before you come to any of our hospitals if you're going to visit, because visitation policies have changed and things can change rapidly on that front. So please call ahead so that you don't show up at one of our front doors and find out that that visitation policy has changed and affects you personally. I do want to end on a positive note. There is good news on the vaccine front. There are 2 vaccines that have asked the federal government for emergency use authorization. We expect that those will go to a committee on the 10th of December, and that shortly thereafter, if approval is granted, that we will have some vaccine available in the state of Maine. However, this will be an extremely limited supply, and therefore the federal government is going to dictate who is eligible for the vaccine first. We expect that to be, because of the limited supply, healthcare workers and emergency responders who are dealing directly with COVID-19 patients. And so that will not even be all of the healthcare workers that serve our needs either in our system or in the other hospitals and other systems across the state. It'll be a targeted thing. As the winter goes on and we start into early spring, we will see an expansion, we hope, of a vaccine and eventually get to a point where we can vaccinize the general public. As all of that happens, we will continue to communicate as thoroughly as we can as to what options we have and when it will be safe for individuals to get a vaccine through one of our organizations or one of the other many ones across the state. We are so proud of the collaborative effort between the state CDC, other state agencies, and the other health systems across the state. It is remarkable what we can do here in the state of Maine to keep our Mainers safe, and we will continue to do so. And with that, I'll open it up for questions.
Okay, thank you very much, Dr. Jarvis. I don't see anybody here from Star 97.7. So TJ from ABC 7 Fox Bangor, as soon as you see your mic unmuted, go ahead and ask your question.
I will find it. Did I unmute it? No.
You're all set, yep.
Okay, good. Dr. Jarvis, good afternoon.
Good afternoon, TJ. It's good to hear from you again.
You as well. I hope I correctly got the number. Did you say 21 being treated at EMMC?
Actually 27 as of this morning.
27.
I will say these numbers are very much in flux now as we are seeing that increase, and so we see these numbers go up and down pretty regularly throughout the day, but as of this morning, 27 inpatients at Eastern Maine Medical Center.
So my question is, how many of those are in ICU and how many should be in ICU generally, and what's being done with the overflow?
So across our system right now, we have 16 patients that are in our critical care units because of COVID-19 and the need for critical care. It's difficult for me to say how many are actually at Eastern Maine because we do use one of our intensive care units as our primary isolated area for COVID-19. So not every patient that's within that intensive care area requires intensive care. It's just our first stage of our area to keep our staff and other people in the hospital protected by having a protected COVID unit. I will say that we have opened up 2 more COVID units in the facility in anticipation that our numbers continue to rise so that we are ready to meet the demands of our community in the state.
What would be the capacity with those 2 additional units, including the existing one?
Yeah, so remember that Eastern Maine Medical Center is a large facility. We have the capacity to have 411 patients here of varying degrees. Obviously, we're not anticipating that for all of COVID, but we continue to flex whether our needs are for COVID-positive patients or for the general community at large, and we will continue to do that. We do have some surge plans that we can activate at any given time, and we continue to actually review those now almost on an hourly basis due to the way things are going right now. But right now, we do not see that we have a capacity problem or that we will have an issue in the short term of dealing with what's going on right now.
Okay, thank you, TJ. Bob Evans, News Center Bay, you're up next.
Good afternoon, Dr. Jarvis. This week, the Vermont National Guard began building makeshift emergency hospitals and emergency healthcare locations in that state. At what point of capacity will you need to get to before you request that the state construct the emergency healthcare center that was talked about early on at the Cross Center?
Yeah, so that's an excellent question. The question is as we see other states needing to build additional hospital facilities and care units, are there plans for us to do that? I will say that just like we talked about in the very early parts of this pandemic, we have those plans in place both for Bangor and Portland. Here in Bangor, EMMC will be taking the lead if that was a need. Right now, we do not think it's a need, but we continue to work with our partners around the community here in Bangor as other places do around the state. We do feel that we could operationalize an alternative care site within 3 to 4 days if we needed to. We do not see that we have that need right now. Again, we don't have any specific trigger, and the reason for that is that it's multifactorial. We could handle many COVID patients if we didn't have to handle patients who have other health conditions, and so it's really a balancing act between the two. Right now, we feel we have the capacity across the state, and particularly in the greater Bangor region, to handle what we are doing, but we continue to work with our state and local governments in order to prepare us if we needed to do that, but right now we don't think we need to. If that's to change, we certainly will reach out to the media.
Understood. How is your staff holding up, and what kind of things are being done for the people on the COVID front line to ease the burden and stress of their job?
I'm going to have Paul Bolin answer that question for us. Thank you.
Hi there, good afternoon. I'm Paul Bolin, Senior Vice President and Chief Human Resources Officer. First, let me say our staff have been phenomenal throughout this pandemic, and especially now as we see a resurgence in our COVID care and other needs throughout the system. We've been surrounding our employees with support both on the behavioral health side, our Healthy Life Resources and employee assistance programs, providing assistance for employees and their families working through issues that could be challenging, whether directly or indirectly related to COVID. We've been flexing our policies to be supportive for varying schedule needs to support employees and their families as they look at remote schooling and other needs. So there have been a myriad of issues that we've taken on to make sure that we're providing the utmost support to our staff. Things such as personal protective equipment that were so concerning early on in the days of the pandemic. The work done by our supply chain to secure PPE for our employees, both through normal supply chains as well as working with Intention and Herman to manufacture appropriate PPE right here in our area, are some examples of the things that we've done to support our team. And as the holidays approach, it requires a redoubling of that support to ensure that employees are able to celebrate the holidays in a safe fashion with families. A lot of Skype visits and the like happening with people as we all likely are doing things differently this year.
Thank you very much, Paul. Thank you very much, Bob. Next up, we have Kate Koff with Ellsworth American. Kate, as soon as you see yourself unmuted, go right ahead.
Thank you very much to both of you. Two questions, both on vaccinations. So once we enter the first phase of vaccinations, is the plan to roll them out system-wide all at once, or are you going to go hospital by hospital?
So Kate, that's a great question, and great talking to you again. So the question is when we do have vaccine available to us, will we be doing that system-wide or hospital by hospital? We intend that the initial phase, which would be Group 1A by the federal guidance, that we will target those areas, which means that each hospital that is currently taking care of COVID-positive patients, we will try to vaccinate those. It will be a process for us. It will rely heavily on our human resources staff and our medical staff expertise to determine which individuals meet the criteria and that we can vaccinate as soon as we can. We will state that before we administer any vaccine, it will not only go through the federal process for emergency use approval, but also the national certification for immunization. The ACIP will also weigh in, and then we will do our own internal look at the data like we would for any new medication or biologic agent that comes across to be utilized in one of our hospitals. So we will make sure that it is safe because we want to make sure that we are safe for our healthcare workers and then ultimately safe for the general population. So it will be a phased-in approach and it will probably be decided based on more by the volume of vaccine that we actually get rather than having a pre-plan that this is the hospital that's going to get it first. We really want to make sure that it gets to those healthcare workers who need it the most.
Great, thank you. And then the second question is, perhaps this is a silly one, but what will happen, if it is 2 doses, what will happen in between doses? Do I get a dose of the single, the first shot, and then can I, go maskless to a wedding or something? How does that work?
Yeah, so Kate, actually that's a question that comes up here at the medical center and across our facilities across the state is, well, if I get the vaccine, can I stop wearing my mask? And the answer is, I do not expect that in the year, the rest of 2020 or all of 2021, we will be going without masks, regardless of what the vaccine supply is. And that's because that's the nature of the way viruses are. Viruses, continue to linger. No vaccine gives you 100% protection, and frankly, we know that not 100% of people are going to get vaccinated, and therefore there's still going to be community spread. There's still going to be that risk, and so we're going to say that we're going to recommend that you continue to wear masks for a prolonged period of time. We're also not 100% sure as to how quickly the vaccine shows immunity and grants immunity. You are correct that the two prevailing vaccines right now that have both asked for emergency use authorization require 2 doses. We will actually have in place a plan so that we ensure that individuals who get vaccinated know when they need to come back for that second dose and that they get the correct vaccine at that second dose. These vaccines are not interchangeable. And so we will have that strategy all laid out in plans, and we will make sure that the population knows as they get vaccinated when they need to get that second dose. We do know that second dose is really a booster, and so there will be some immunity for the first one, but it will not be immunity that would protect the overall population enough, and so that it's critically important that people get that second vaccine. And then it'll be a while before we see that the overall level of virus around our communities goes to a level low enough that we can stop wearing masks. So in between those 2 shots, yes, you have to take all the same protections as if you hadn't received one at all.
Hey, thank you very much, Katie from Ellsworth American. Thank you very much, Dr. Jarvis. I believe next up we have Marissa Bodner from WGME. Marissa, if you would unmute yourself and ask your question. Marissa, is there anybody there? Going once? Going twice? Okay, Kevin Miller from Portland Press Herald, if you would unmute yourself and ask your 2 questions, that would be great.
Sorry, I just got unmuted. It wasn't.
Oh, you just got in under the tag.
It said I needed permission, so now I have it.
Okay, go right ahead.
Hi, Dr. Jarvis.
Hi, Marissa, how are you?
Good, thank you. My first question is, you guys obviously have a system statewide with different facilities. Are any patients being transferred among the various hospitals?
So as a matter of course, that happens all the time with normal health conditions that serve needs. Eastern Maine Medical Center certainly is a regional referral center, and that continues. I will say that most of our hospitals, I have been both amazed and grateful and just overall ecstatic about their ability to care for COVID-19 patients within their own institutions. And so we've seen that across the state, both with hospitals associated with one of the healthcare systems and our independent hospitals as well. But then there are certainly some patients with COVID-19 who require critical care and, yes, have been transferred to a regional medical center such as Eastern Maine. And so that's a common course. It is not common for us just to transfer a patient because they're COVID-19 positive, but really because of whatever level of service that they need. And so that continues. And like I said, Sebastian Valley Hospital has been able to maintain taking care of their patients, and I'm proud of them for that. And I applaud every one of our frontline healthcare workers who have been able to stay on the job and take care of these individuals so they can stay close to home. But if those patients get sick enough, and we are here and ready at our regional medical centers across the state to take care of them as well. Thank you.
And my second question, in terms of just preparedness and response to this, how are things going now compared to when it was sort of early on back in the spring? Is there anything you learned then that you're doing differently, or has it all gone pretty smoothly?
Nothing in COVID goes smoothly. I continue to say that everything about this particular virus is hard. But I will say that we are far better prepared now because we know a whole lot more. If you remember in the beginning of this pandemic, we really didn't know how transmission was occurring. Now we know very well how transmission is occurring. We know that it is from the droplets that come out of our mouth when we talk, sing, yell, scream, sneeze, cough, and the like. And so we know how to protect ourselves much better than we did in the beginning of the pandemic. It's remarkable when you look at the numbers of healthcare workers who have been infected at work is incredibly low across our health system, and we're proud of that because we know how to protect them and we know how to protect our patients. So that is important. That allows us to keep our workforce in a good condition in order to be able to be and serve our communities. We also know how to treat this virus so much better than we did in the beginning. If you remember, in the beginning there was lots of confusion whether this drug or that drug would be useful, whether we should use oxygen, whether we shouldn't use oxygen. Now we have care plans in place that actually help guide our providers so that they can take care of patients appropriately based on the patient's risk factors and their symptoms. And now we have some treatment plans that we can actually use in individuals who are patient setting in order to help try to limit whether or not they will need emergency care or need to come into our hospitalizations. And we've been rolling those out across the state of the last week or so. Unfortunately, for all of those things, we have limited supply, and therefore it will be difficult for us to manage that, but that's what we do as a state, and we are good at it. And so yes, we are better prepared now because we are smarter now than we were then, and I think that's the key. When you hear us speak, even if we say something different now than we said in March, the reason why we say it different now is because we know more than we knew in March, and that's the key to the fact that we are well prepared to take care of the patients that we're doing right now.
Okay, thank you very much, Marissa. And next up, Kevin Miller from Portland Press Herald. Kevin?
Yeah, thanks very much, Dr. Jarvis. My questions are about testing demand and capacity. Looking at your system, it looked like there was a several-day long waits for appointments for asymptomatic individuals at some of the swab and send facilities that Northern Light operates. Can you talk about that and just about what kind of demand you're facing and your ability to kind of keep up with that demand, both for symptomatic and asymptomatic individuals?
That's a great question, Kevin. Thank you. So the question is really about testing capacity while we see this demand increase. The fact of the matter is that nationwide we are in short supply of both test kits, testing apparatus, and the machinery that actually runs the tests once they come to the lab. That is no secret. We've been talking about that the entire pandemic. There have been improvements, and certainly here in the state of Maine, we are actually better off by a population percentage than many other states are, but we are still limited in our capabilities. As far as symptomatic patients go, and certainly patients that are being admitted to our healthcare facilities, we believe we have adequate supplies of testing and that our turnaround time for those are, generally speaking, well within what's important for clinical activity. But if an analyzer were to go down, a shipment gets delayed, something like that, that's what causes those longer delays that you're seeing. Northern Light Health and its laboratory has been very remarkable at being able to keep up with demand. We have partnered with some outside laboratories to handle when our volumes get high, and in particular things like when people are just getting a test because they've traveled or something where it's not a clinical situation that requires them to get tested. We have been able to manage those clinical situations, and we continue to do so on a regular basis, but it still continues to be challenging for us. It is not uncommon for us to go, we hope that delivery happens this week so that we can continue supplying the tests, being able to provide those tests. It's wonderful news that the state has been able to partner with Walgreens for some rapid testing. Again, that's only for symptomatic people, but if people with mild symptoms get tested there, then that helps us at the medical center to be able to test those individuals who have more severe symptoms. So that's a great partnership, and we continue to expand at Northern Light Lab, as does the partners and the state itself on a regular basis.
Hey, Kevin, do you have a follow-up question?
Yeah, just a follow-up on that. So are there any plans at Northern Light to expand your testing capacity? Particularly, I mean, it seems we're obviously seeing a lot of demand from people who are traveling or want to make sure that they're safe before they meet with family members. Those folks who are not exhibiting symptoms. Is there any plan to expand your capacity immediately after the holidays to deal with folks who are coming back, or the people who the anticipated surge we're probably going to see after the holidays of people who actually are exhibiting symptoms?
Yeah, so the question was, do we have plans to expand? And we've been expanding the entire time. If you remember, we initially talked about that we could run only a few hundred tests a week. Now we're running several thousand tests a week. And we continue to expand in other areas. So our pharmacy on State Street has the capacity to do testing as well. It's a great place for people who are traveling. There is a cost to that because it doesn't fall under the state exemption. And so again, if you go to northernlighthealth.org/testing, all of those opportunities are there for what Northern Light can provide. We continue to look and see if there's capability for us to expand hours for testing. I think one of the points that you had made is that if you try to schedule a test for an asymptomatic patient at one of our swab and go sites, that it may be several days before that test can occur. If you're traveling, I strongly encourage you to go to the website before you travel so that you can schedule your test for when you arrive back home. That's a really important thing to do because, as you said, the volume is increasing. But we continue to look at how we can improve our staffing and lengthen our hours to be able to meet the needs of an entire state. But once again, I want to stress that when we feel there's a clinical need for testing, we are able to do that, and in fact, right now are able at our hospitals to do that in a more rapid fashion than we were just a few months ago. And so we continue to make improvements and continue to try to expand out testing as much as we can. The state does the same with their lab. So thank you for that question.
Thank you very much, Kevin. We're going to move on now to Greg Levinsky from the Morning Sentinel. Greg?
Yeah, thank you, and thanks, Dr. Jarvis. So you talked a little bit about the Sebasticook Hospital, and you said that they've done a good job of kind of containing their COVID patients. As Somerset County has seen quite a bit of an uptick, do you anticipate that Sebasticook and maybe even Inland and Waterville will continue to be able to be kind of self-sufficient in fighting an uptick?
Yeah, so I feel very confident in all of our hospitals across the state, and that does not just mean Northern Light hospitals. I mean all hospitals across our state can manage their patients, and that if they need services beyond the capability of the local hospital, they know where to go and reach out to get that. I feel that all of our hospitals are safe across the state. We've been doing this for quite some time now, and while all of us have COVID fatigue, this is not the time that we are letting our guard down at all. In fact, like I said, we are putting in even more stringent visitation at some of our hospitals, and so again, call ahead beforehand. But yes, I do feel that our smaller hospitals have the capabilities and the knowledge and the wherewithal and the staff in order to take care of patients with mild, moderate disease and sometimes even severe disease to do so safely, appropriately. And they know, just like we would with any other medical condition, they know what their limits are and will refer out if they need to.
I just wanted to confirm, you said there's one COVID patient in Sebasticook, and you didn't say there were any in Waterville at Inland?
That is correct. One, and that was as of this morning. Obviously, things can change rapidly with this particular virus.
Okay, thank you.
All right, thank you, Greg. Let's see, next up is Amy Brown from WERU.
Thank you.
Amy?
Thank you. Dr. Jarvis, about 2 weeks ago, the Maine CDC said that the state would start receiving 90 doses a week of the monoclonal antibody treatment at some point. I don't know if that started yet. And since that time, the FDA has given emergency use authorization for the use of at least one of those monoclonal antibody cocktails for people with even mild and moderate symptoms if they're at high risk. I guess I have kind of a two-part question on that. Have you started receiving that yet? And if and when you do, how do you anticipate prioritizing who will receive it with such a small amount being shared across the state?
Yeah, and that's the dilemma that we are dealing with right now. I will state that the state did receive its initial weekly supply. Unfortunately, we've been told that the second week supply will be almost half of what we had gotten the first time around, so that's concerning to us. It is good news that, as you said, the second monoclonal antibody, which is actually a cocktail of two separate monoclonal antibodies, has gotten emergency use authorization. We expect that they will be able to at least match the first one, but still those numbers are woefully low. So right now, leaders across the state, experts in infectious disease, and those of us who have experience with medical management, as well as our pharmacists and other reliable individuals, are discussing that and how best to utilize the supply across the state in order to make sure that we are doing maximum good with what we receive. We are hopeful that both manufacturers of these and possibly other manufacturers who are also working on monoclonal antibodies will be able to ramp up their production and be able to, we will be able to secure more of that. Most of this is being handled at the federal level, and the federal level is dictating where those supplies go. For further information, though, I will pass you off to the Maine CDC as they have the more up-to-date and current numbers for how distribution will occur.
Great, thanks. And my second question is, once the vaccine becomes available, will staff who work directly with COVID patients be required to receive the COVID vaccine?
So at this time, this has only been given emergency use authorization, and under the guidelines that happen with the FDA, you could not mandate something that only has emergency use authorization. Certainly around the country, people are talking about that if and when they get full FDA approval, if that would be a course that people will follow. We certainly have discussions like that internally, but at this time, we have not made any decision about whether we would make any vaccine mandatory, and we will just continue to monitor as the nation learns more about these products.
Okay, thank you very much, Amy. And last but not least on the list, we'll have Spencer Roberts from WABI.
Hi, thank you. Two quick questions. Just one about, we've seen some reports that EMMC actually has like the highest average number of COVID patients right now compared to other hospitals around the state. I know you mentioned that, some patients get moved around and things like that throughout the course, but is there any kind of understanding of why that might be, considering that Bangor is not necessarily the highest area in terms of patients in general, or cases?
Yeah, so the question is why is it that EMMC seems to, at least for the last few days, had the highest number and highest percentage of COVID positive patients, even compared to Maine Medical Center down in Portland. I don't have a good answer for that. I will say that the reason why EMMC is seeing the uptick now, again, it's the regional medical center from Augusta all the way to the Canadian border, and so therefore we do take patients from a larger geographic region than our friends down in the southern part of the state as a regular part of our business. But we also see that the spread now in our more rural communities is far greater than it had been early on in the pandemic, and in fact in some areas is greater than what we saw in the southern part of the state early on in the pandemic. And so it's just a sheer volume issue. We're here, we're in the center part, and so more patients will have access to us who now are positive with COVID. I don't know if there's some thought there that at least down in the Portland area where they were dealing with high numbers in the beginning part of the pandemic, maybe they are wearing masks more often. But I will tell you, masking, social distancing, good hand washing, staying home when you're ill, and avoiding unnecessary travel, those are the keys to getting this virus under control. And we really need that across our entire state, but especially in our more rural counties where they are hampered by total number of bed availability and then having to travel to Bangor to get care because either they're underserved or the caseload is too high in a particular community is just not what we want to see. So wear your mask, stay home when you're sick, stay socially distanced, and don't travel if you don't need to.
Thank you. And then we received a written statement from the hospital regarding a Northern Light Health employee who passed away from COVID-19 acquired through community exposure. Understanding privacy and respect for the employee and their family, would you be able or willing to speak to that loss here?
Other than to say we are saddened by that loss, and our sympathies go out to the family and to the community as well as co-workers of that individual. It's a sorrowful situation for us here at the medical center, and it hits home. And it tells us this is real. It tells us we need to continue to be diligent and that we all need to take care of one another and we need to take care of our communities. Now is not the time to say it's all about me, because it's not. It's about all of us, and everybody that you come in contact with is just another person that you, if you don't take the right precautions, could infect, and then you could experience a loss in your family, in your community, in your workplace. And we don't want to see that happen unnecessarily. We want people to stay safe. We want them to be healthy. And we don't want any other business, industry, community, or family have to go through what our family's doing right now. And so I thank you for bringing that up. And again, our sympathies go out with that family, but we will not share any further details beyond what we did for privacy reasons.
Thank you very much, Dr. Jarvis. Thank you very much to all members of the media that participated in this press conference today. We certainly covered a lot of ground. And we will make a recording of this press conference available to you. as basically as it's unfolded and happened. If you, again, I asked you at the beginning if you wanted a higher resolution copy, just to put your email address in the chat window. I'll leave the window open for a few more minutes if you want to do that. If there's anything else you need, you can certainly email us afterwards for follow-up as well. Thank you again for participating today, and have a great rest of your day, and a happy Thanksgiving.
Thank you all.
Thank you.